Do you feel like your spine is twisted, or you might have scoliosis and you need something to prevent it from getting worse? Or worse yet, you've got some pain in the small divots of your spine. Is it too loose, or popping all the time, or something you want to crack yourself? These are all too common of an issue for those missing this important muscle. Hi, I'm Dr. Justin Lin, chronic pain specialist at Rehab and Revive. Let's get to solving this issue right away. Multifidus muscles are the muscles we need to keep our spine stable. Each segment has its own set, and each segment in itself has a potential set of injuries that could happen because of disuse, misuse, abuse, which will inhibit this multifidus muscle. All right, y'all, so we're got my favorite spine. I named my spines Albert for one of my best friends from high school who had literally the perfect posture. You'd be surprised I did not have the perfect posture in high school, but Albert did, and so all my spines remind me of my one of my besties. So basically, back into it. Look at Albert's spine, and we're going to talk about today. We're going to talk about the upper back, upper thoracic. Now, you're going to use your elbows as part of this exercise, this lift off. But importantly, a lot of times people have this popping nature because it's unstable or it gets locked up. And really, you got small muscles, and these multifidus muscles, they go and they span, kind of one segment at a time, and every segment's kind of got their own, and they protect the ability for it to not rotate. And it's just kind of, if you got both sides helping, then you have a very stable brace, basically like a neck brace or upper back brace, and holds it. So you want these things to just kind of, and they're very close to the spine. I think you guys don't really appreciate, but you got the paraspinal muscles, your lats, all those ones kind of span out here. You want that to be stable at all times. So we're gonna put this away and we're gonna get right to the exercise. All right, so we're gonna set it up like this. You're gonna be on your elbows and knees, everyone. You wanna you don't want it to drop like this, so you wanna get the muscles engaged by literally pushing through your elbows. I'm pushing through this line here, and I'm just trying to drive that up. Now, what I want here is I am going to start unweighting one side at a time. So basically, if I was here, you can kind of see the vinyl here of the table, and what's going to happen here is I'm just going to unweight it, and then so I can just hover. And so that's kind of what it is. This is like a plank. This is like some of the other exercises we've done. We have lift off for the lower body, but what you want to do is you're trying to fill in those muscles I just showed you on the spine of Albert, and we're just trying to get those muscles to stabilize. So what's going to happen is I'm going to do this side here, and it doesn't look like much, but if I put a bottle of water on my back or created a little frame that looks like a table, we don't want it to be wobbly. For those of you with scoliosis, like one side, I would argue as you do this on one side, you're going to just kind of notice that you probably do something like this and drift. So you don't want to be here. Create that frame, and you're going to target. If I'm going to work this side, I'm going to slowly initiate by getting that, and I should be able to do this, but you can hold that. And same thing here. I'm gonna reinitiate. I don't want to drop. Reinitiate that, create that frame. Should be able to just nicely freely move. As you want to fill in these muscles, for those of you with scoliosis, one side is working really hard and one side is not. So what we want to do, if I'm going to do this side, I'm just slowly trying to unweight, and you can still touch the surface area, but this is all it is, right? I've basically, with all four limbs, it's from 25% of my weight, basically evenly. But as I slowly unweight, I'm redistributing more weight into this, and this. And notice how I didn't change the frame here. I should be able to just lift one arm away and keep that. I don't want to drop. I don't want to drift. That's not a good idea. So what you want to do is just, you're going to hold it here. And then if I were to do this side next, you want to hold it here. You're going to hold it, right? And I would argue this side for me is tougher because I want to naturally fall forward. I'm doing everything in my being to impress you guys here that I wanted to just naturally just go here. But it's just, I can tell you this is a lot easier for me than this side. And what's happening is when you do the lift off of the upper, so it's a little different when I do the lower, it's actually contralateral multifidus. I would say when I'm doing it this way, it's the same side that is, I'm actually waking up these sides. These sides. When you're doing your legs, it's, I think, the opposite. So basically, like I said, here it is again. And for those of you talented, maybe you do both. I'm just kidding. Yeah, otherwise you're gonna fall on your face. But that's pretty much the exercise. But that's pretty much the exercise. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter,